Well, good morning, everyone. My name is Vince Hawks. I'm the Director of Global Policing for the International Association of Chiefs of Police. I'm the former Commissioner of the Ontario Provincial Police in Canada, so I'm the Canadian representative on this panel here this morning. And I'm very pleased to be able to moderate this group of individuals who are going to present to you on a number of issues associated to the International Association of Chiefs of Police and our crossroads right now with the public health. Just trying to, there we are. I'm going to start with the introduction of the IACP and what we are all about. And then following that, the intersection that I spoke about with public health and what IACP is doing about that will be Kelly Burke. And then we'll turn it over to Colonel Farinetto, and he'll speak to the Bloomberg Initiative on Global Road Safety. And then we're also pleased to have with us retired Chief John Morrissey, who's going to speak to us today about preventing law enforcement suicide. And Chief Don Hedrick from South Dakota will speak about the collective healing from his experience in Rapid City. And then following that, we'll have the question and answer session. So to begin, what is IACP all about and what do we do? Really is all about the policing profession and how do we as an organization shape that policing profession. And that's done through advocacy, research, outreach, and education. And a good example of the outreach is the connection between IACP and Nick Croft, for example, on the Law Enforcement and Public Health Association. So IACP is a large organization. We're probably the largest police leadership organization in the world, with over 31,000 members in 168 different countries. And we provide members with the opportunity to connect. And that connection is providing resources in order for those members to utilize all of the advantages of this association. We provide the ability to participate in conferences and events like this. We also continue on that learning spectrum for all officers at different levels, and I'll get into that a little bit more. And the advocate piece, as well as that personal development of officers as those members who are trying to progress to become higher ranking, but also learning about the profession in a different way and enhancing that their development. But IACP is not just about police chiefs, and it's one of the misconceptions out there. Yes, we have an association that was designed and created from police upper staff executive leadership, but we also have different membership capabilities and categories for all levels of the organizations, and also the academic piece. And we've seen in the last number of years that growth on that research piece, and why is it important to IACP to have that academic piece and involve students as well as the private sector. When we speak about advocating for the profession, it's not just about what happens domestically in the US. Yes, that's a key piece because primarily our members, the largest number of our membership is from domestically within the US, but also the issues that are happening worldwide on the global scale. And that's why the communication tools are so important that we've developed and incorporated not only on our website, but the ability to share information and best practices, policies, etc., becomes so important on that communication side. And of course, the policy piece is key. We have that ability to look to what are the best means from the experience of all of the members to create policy that is generic, that other organizations can latch onto, as well as as position papers, etc. So it becomes a whole communication tool and the ability for us to influence the profession in a special way. So some of the tools that become so important to police leaders are developed through our policies, our law enforcement policy center. An example of that is the bias-free policing model policy. And we have a number of model policies ranging from numerous topics that most police organizations are looking for. And with 18,000 police agencies in the U.S. alone, and with a variety of standards and different policies, really the IACP becomes the go-to place to begin to look for what's the best policies out there for an organization. And then there's all of that sharing that happens. The IACP Lead is a daily news service that goes out to all members, keeping everybody up to date on what's happening. One other example is the Collective Reform Initiative Technical Assistance Center, that's CRITAC Center, made up of a number of organizations working together to find out from a technical assistance to other organizations on what we can do as a one-stop shopping for whatever the topic is, whether it's battling the challenges of COVID-19, for example, and being flexible and nimble enough to make changes as we go with recommendations on the different policies and procedures that agencies should do. Our Police Chief magazine, and there's 3 examples of the front cover of the Police Chief magazine on the slide there, on most up-to-date issues associated to policing, whether it's critical communication, leadership during crisis, and that reimagining policing and all of the defund the police movement. And each one of those magazines are full of articles on various things associated to the theme of that monthly magazine that goes out to 31,000 members worldwide. We also have IACP Net, which is a valuable tool for research, and it is a process of capturing research from around the world on various topics, from what's who's doing what on body worn cameras, for example, and how are we dealing with use of force issues over here, et cetera, et cetera. And then we have another publication, a newsletter that comes out monthly. It's just the IACP monthly. Number of programs and projects on the go, and Colonel Farinetto is going to speak about the Bloomberg Initiative on Global Road Safety. But not only domestically but internationally, we have different funding agents that allow us to provide technical assistance and training and expertise around the world. At the same time, providing professional services, whether it's management studies, with the development of future leaders through promotion, and examples of assessments of different things, from police academies to assessing the HR pieces on staff development. The IACP is a big, complex organization, and it's made up of divisions, sections, and committees, and a policy council. And these are organizations within the organization that allows us to be focused on themes and topics. So the state and provincial police, so that are the police commanders on the traffic initiatives are state police, not only in the US but in Canada as well. And then the state associations of chiefs of police. So every state has its own association, and they're all combined as well, mid-sized agencies. And then of course the global policing division, which is everything outside of the United States. And because there's so many committees and sections, they created a policy council which groups them together based on themes, so that we ensure that a committee that's working on an initiative is linked to another committee working on something very similar. And there's 27 committees. Each one of those committees has 30 people on it, and then 18 different sections. So there's a lot of coordination going on, a lot of work, a lot of activity that members get involved with in order to collectively come up with the positions of what IACP is all about. So it's our position paper, our position on a number of topics, whether it's use of force, producing products associated to that for our membership. And then we have annual awards and recognition pieces. And on the participation and learn, it's we just completed our Officer Safety and Wellness Symposium last week. This incredibly successful symposium, all virtual, like we're doing here today, with over 1,000 participants, all focused on officer safety and wellness. If we cannot have our officers healthy, then we cannot do the job that the public expects of us. And there's a lot of focus and attention on that, and it really is critical at this time of year. It's probably doubled in the last 2 years just on participation and expertise and the training initiatives, workshops that are ongoing. Our a policy council mid-year, that's where all those committee folks would get together and have a discussion about what are the primary topics. Those topics need to be focused on what's happening in modern policing today, what direction the organization needs to go, make recommendations and resolutions that move up the chain in order to the IACP to move in one direction or another. And of course, the technology conference, with the advancements in technology these days, very difficult for police organizations to keep up with it. So in order to have a venue where we can discuss and look at all options that are out there, the most modern technology, and have the discussions, whether pros and cons when it comes to things like facial recognition software and so on. Those are the type of in-depth discussions that happen on forums like this. The conference on the drug, alcohol impaired driving is key, and not only, again, domestically, but worldwide. And that expands into the Bloomberg initiative as well, too, that Colonel Fernando is going to speak about. And of course, our annual conference, which last year was 100% virtual. And this year, we're hoping to have being able to expand that back to in-person as well. COVID has taught us that we really need to have an alternative means to have the virtual piece tied into just about everything we do in order for us to be successful. And I'll end off with the training opportunities. We have a number of training opportunities, obviously, from all those different committee recommendations, the different areas that we have specialty in when it comes to the leadership in police organizations, or planning, designing, and constructing facilities, or Women's Leadership Institute. And once again, that's just not from a domestic standpoint. Each one of these courses can be taken worldwide by the addition of the culture piece, by addition of language variations, etc. And all of this is now stored on our new platform of IACP Learn. And then that allows every member of our organization to tap into IACP Learn, log in, and an example would be Dr. Fauci's presentation to IACP membership, and that stays within the system. So, you know, IACP is really trying to expand everything that we do. And eventually we're at the point now where we really are at a crossroads with the mental or the public health piece, tied into mental health, tied into police reform, tied into alternative processes for delivery of service, etc. So that's the 30,000-foot level picture of what IACP is all about. And now I want to turn it over to my colleague Kelly Burke. I'll stop my sharing here. And as Kelly's getting organized there, I'm going to tell you a little bit about Kelly. She's a senior program manager at IACP and leads a portfolio of training and technical assistance programs for law enforcement and community partners. And she focuses on a number of areas and has some expertise in everything from human trafficking, community-based crime reduction, child exposed to violence and childhood trauma, and that's just to name a few. Kelly is currently one of our Masters of Public Health Fellows with the Bloomberg American Health Initiative at Johns Hopkins Bloomberg School of Public Health. And this is a program that taps into individuals within IACP who are working on their master's program and has that connection between the public health and the law enforcement piece. She's had numerous experiences overseas in London, and working in child exploitation online protection center over in London, and also in the U.S. on the National Center for Missing and Exploited Children as well. So I'll turn it over to you, Kelly. It's all yours.
Great. Thank you very much. Let's make sure you can hear me. Can you hear me?
Yes.
Okay, great. Sorry. Thank you and good morning. The policing and public health fields both aim to address threats to the safety and security of communities. And these threats, these fields are continuing to work together, increasingly working together to tackle these threats, which are driven by complex and interwoven societal problems. And we at the IACP have been working, as Vince mentioned, at the crossroads of both policing and public health practice to promote approaches that are collaborative, cross-disciplinary, research-driven, solutions-oriented, and rooted in community engagement. So this morning, I'm going to highlight some examples of the work IACP has been doing with our partners in the field. But I do encourage you to visit our Policing and Public Health webpage at the iacp.org/public health. The first series of resources I want to highlight are gender-based violence resources, which we have been in this field for more than 25 years, working with multidisciplinary partners in victim advocacy, in mental health and wellness, in developing numerous resources. A couple I'm going to highlight. We have a comprehensive agency self-assessment, as well as an accompanying community assessment for police agencies to work with their partners to deploy to enhance their response to gender-based violence in their communities. We work extensively with building the capacity of law enforcement and their partners to deliver trauma-informed sexual assault investigations and have numerous guidebooks, policies, as well as recorded webinars and trainings that build the skills and abilities of police officers at all levels, from our chiefs, our Institute for on Violence Against Women for police leaders, as well as tools for supervisors and for frontline officers. So I encourage you to visit our webpage to learn more about the resources that we have available on gender-based violence. Human trafficking. This is an extensive portfolio of mine that really works very closely with partners in victim advocacy and victim services to build the capacity of communities to identify and respond to human trafficking. And this includes all types of human trafficking. So this is labor trafficking, sex trafficking, where victims are adults or children. We have developed numerous resources for various levels in policing, from resources for chiefs to we have a whole series on frontline targeted to frontline officers on how to recognize the signs, and all sorts of investigative resources. We've worked very extensively with a network of federally funded in the United States task forces, and worked to really develop with our partners at the Office for Victims of Crime at the Department of Justice, and our multidisciplinary partners to develop a development and operations roadmap for human trafficking task forces to ensure a victim-centered, trauma-informed approach to identifying and responding to victims. We have a number of training series available for all levels of law enforcement and their partners. And this is, as we all know, a growing need in the field to identify and investigate effectively human trafficking in communities. The next series of resources I want to highlight is IACP's work with the Yale Child Study Center, their Childhood Violent Trauma Center, as well as a number of police departments who have implemented a approach to working with children and families who have been exposed to violence. So we have a series of training, online training, classroom training for targeted specifically for frontline officers, as well as a toolkit that contains resources for all levels of policing. And just to give a couple of examples, some of those resources are, highlight what does traumatic stress in children look like on scene, as well as how officers can interact with children, from infants all the way through adolescence in a way that will best support their recovery. So this series is available on our website. I encourage you to check it out. We worked with a number of multidisciplinary partners to develop that. We also have a number of resources related to officer wellness. Obviously, a very big priority for the organization. We've worked with multiple partners to develop resources related to, everything from sleep deprivation and nutrition to financial wellness, and a whole series of tools for law enforcement families. We're going to hear up next from Chief Morrissey around our newly released resources around preventing officer suicide. But we have a number of resources that I would recommend that you visit our website to check out. IACP has been working in traffic and road safety for a number of years with our partners, in the U.S. Department of Transportation, as well as we're going to hear from the Colonel soon about our work with Bloomberg Philanthropies at the global level. Here's just one resource I'd like to highlight. This is our Unjamming Traffic toolkit that is for law enforcement on safer, quicker clearance of traffic incidences to reduce injury and deaths. So we have all sorts of resources related to drug impaired driving, as well as distracted driving and other traffic safety resources. I would like to highlight a piece of work that we are have been engaged in currently and are excited to be piloting this spring. We are working with the Department of Justice and our partners at the University of Cincinnati, as well as Policy Research Associates and the ARC of the United States, which is the oldest civil rights organizations for persons living with intellectual and developmental disabilities in the US. So we're developing a national curriculum that is based upon the crisis intervention training curriculum that will incorporate collaborative crisis response, both to individuals with behavioral health issues, as well as individuals with developmental or intellectual disabilities. And we actually have an application out right now looking for agencies to pilot this 40-hour curriculum in the field. So we're also creating a number of different tools that will help police and their partners better understand the choices or the evidence and the available CIT and collaborative response models that are out in the field. In fact, we have just posted, University of Cincinnati did a whole review of the research and the effectiveness of different types of crisis response models. So I encourage you to go visit our website to see the reports on those. We also have our Home Safe initiative, and this is reducing injury and deaths of missing individuals with dementia or intellectual or developmental disabilities. So this is both addressing children who may wander due to their disability and go missing. So we're working really closely with the ARC again, the ARC of the United States, as well as the National Center for Missing and Exploited Children, to help police and their partners have the tools and resources that they need to prevent children from wandering, as well as older individuals that may be suffering from dementia, and how to keep safe, as well as how to address when they do go missing. We have our One Mind training and technical assistance initiative, which is working to promote police engagement with individuals with behavioral health issues and intellectual or developmental disorders. And these initiatives are really focused on building knowledge and best practice in officers to best engage in situations that are sometimes very difficult. So this is 2 additional efforts that we are engaged in related to behavioral health issues and IDD. We're also working to improve data, which I know is a very important, aspect in policing and public health, so that we can best understand the issues that are faced in communities. We work very closely with the American Public Health Association and the CDC on the National Violent Death Reporting System, and how law enforcement can engage effectively in promoting the use of NVDRS, as well as we work very closely on the National Crime Statistics Exchange, or NCSX, helping police agencies transfer from the summary report for the uniform crime reporting over to the national incidence-based reporting system. And I will wrap up with our collective healing in the wake of harm initiative, which we're going to hear from Chief Hendrick about the work in Rapid City. But this was a demonstration project that was funded by the Office for Victims of Crime at the Department of Justice here in the US. And really, IACP looked to work with communities that really had a need and desire for policing communities to come together to address the impact of trauma on those who served and on the workforce that are providing the services. We worked with 5 communities, Baton Rouge, Houston, Minneapolis, Oakland, and Rapid City, and really dove in through really customized assessment at both agency and community levels in these cities, and explored the connection between historical trauma and present day experiences, and the lasting effects of the tensions and trauma on both police and the community members. So we're going to hear from Chief Hendrick in a moment on the work in Rapid City. So I will hand it back over, and we'll hear from police leaders to talk about their spotlights in what they're doing in their community.
Well, thanks, Kelly, and appreciate that in-depth view of just some examples of the IACP has aligned with the police and public health. Next, we're going to hear from Colonel Farinetto, and he started his career in law enforcement in 1985. And throughout his career in São Paulo State Military Police in Brazil, Colonel Farinello rose through the ranks and retired as a colonel in February of this year after serving 35 years in law enforcement. In 2017, after graduating from the National Academy of the FBI, Colonel Farinello began collaborating with the IACP when São Paulo Military Police joined the traffic safety program as part of the Bloomberg Philanthropy initiative in the global road safety. And then after his retirement, we're very fortunate to have Colonel Farinello working with us directly as a consultant for IACP, continuing to work on this initiative in São Paulo State, Recife, and the cities of Salvador as well. So I'll turn it over to you, Colonel.
Colonel, you're muted.
Thank you, Jason. That's a pleasure to stay with all of you today. This Global Law Enforcement and Public Health Associate. We'll start to talk about the experience that the Bloomberg Philanthropies Initiative for Global Road Safety made in São Paulo City. And we start in 2020, the cities that is mentioned. Salvador and Recife is northeast of Brazil. And we start the expansion planning in São Paulo State. We start in 2017 and 2020. You had worked just with our urban traffic policy command, and you make some kind of extension and put our highway policy command too, and choose 12 points of highways around the highways of the state to make a lot of fiscalization. Of course, this 12 points, that's the meaning of choose, is because there's a huge hotspot of accident and fatalities. So we start here. Oh. Okay. One overview about this. This is a significant photo that I will explain. Multi-year and multi-partner initiative aimed at reducing road injuries and fatalities in low and middle income countries, and funded by Bloomberg Philanthropies. Focus on 4 risk factors: speeding, drink driving, motorcycle safety, helmet use, and seatbelt restraint use. Well, it's common. It's very, very incredible. In my country, it's common. The motorcycle uses the middle line into the main lines of the traffic. So that's a very common situation that happens all the day for all cities around Brazil. But you can imagine this photo. You see that's a rainy day. You can imagine if this motorcycle stops suddenly, and could imagine what happened with the other riders there, isn't it? So we have the bigger problem, the most problem of our urban traffic and highway policy patrol. There's the accident with the motorcycle. We have a lot of fatalities and injuries with all the motorcycles, and you need to try to change this behavior of the riders. Our partner in this initiative, we have Johns Hopkins University, Vital Strategies, a Global Road Safety Partnership, World Bank Global Road Safety Facility, Global REF Advocacy Incubator, World Resources Institute, Global NCAP, and GDC and NACTO. Of course, the main proposal today, the work for our partner who included in this discussion, the World Health Organization. The IACP work with the traffic enforcement agents of restraint enforcement, provided trainings and technical assistance, and provide equipment. During 2017 and 2020, we work with IACP, and there is in the right side of the picture, there's an officer who belongs to our urban traffic policing commander. And the left side, we have the agents of our engineer traffic company. So we work together in São Paulo City. Of course, the fiscalization, our military police work, and the design and the urban engineer, the traffic engineer company work, and we have a lot of task forces that I will show in this our presentation. Is road safety is a public health concern? Of course, that's a big problem. We have a lot of accidents and fatalities around the world. And we have 1.35 million people die each year as a result of road traffic crashes. 50 million people are injured each year because of road traffic crashes. 8th leading cause of death worldwide. Leading cause of death for children and young adults from 5 until 29 years old. Low and middle income countries, we have 93% of world fatalities in the world, 60% of world vehicles, approximately 5% of the GDP is lost in low and middle income countries. 2021 and 2030 is the second decade of action for road safety. This photo you can explain that's a kind of motorcycle fiscalization. We have in São Paulo City two main rivers who pass through the city, and there's big avenues who go follow these rivers. We call marginals, the name of it. We have a marginal Tietê, the name of the river, and the marginal Pinheiros, the name of another river. So these officers stop all the traffic for 1 minute and put all the motorcycle to make some fiscalization. We have two procedures of this kind of stop all the traffic. One for fiscalization, that's usually use this, and one education program that I show some pictures and explain very quickly. We have a safe system approach, that's safe road use, safe roads and roadsides, safe vehicles, and safe speeds. So IACP is working in Latin America and India. We have works in Argentina, Buenos Aires, in the south of South America, Brazil, São Paulo State. That's why the reason that our extension program, I repeat, the 2017 until 2020, just São Paulo City. And 2020 and 2025, we work in the highways that I said, and I forgot to see, we will extend 3 cities around the city of São Paulo. São Paulo, that's a capital of São Paulo State. We start working in 3 cities as Osasco, Santo André, and Guarulhos. There's big cities around São Paulo City that our urban traffic policing command start to work too. We have Salvador and Recife that I said is the northeast of Brazil. We have Colombia, Bogota, and Cali, Ecuador, Guayaquil, and Quito, India, Delhi, and Bangalore, Mexico, Guadalajara. There's the cities that work in Latin America and India. Safe speed education, training, and enforcement in São Paulo, Brazil. Wow. We work together, that I said, with our traffic engineer company. We have a lot of task forces that each agents work together with different ways. One way that we work, it's amazing work that you have and reduce the accidents around the bars and restaurants, main during the night, of course, when the customers drink a little bit more. But we try to make one kind of conscience program with them. We were going to the bars and restaurants and speak with all the customers and about the risks to drive after drink. So there's a very good acceptance for all population. They said that is a very good initiative for military police. And after that, of course, we make this kind of education program near to the hotspot of our fiscalization. So after spend 2 or 3 hours in all the restaurants around our hotspot, we start a fiscalization operation nearby for make sure that all the customers understand why we try to save for all. Unfortunately, we have some drivers who had drink something and need to make all the fiscalization and put all the penalties and tickets for them. We have another program too to make a conscience of the relatives near these schools to understand how important to make safe the kids. You see on the right side and on the top the instruction of the officers before the operation, and one picture of the mother to try to put the seatbelt of his kid, and on the top on the part below of the right side of these pictures, we have one officer and one teacher to talk with the relatives about how important to use all equipment with the kids. It's a very, very successful program that you use mainly when they start the initial program of the schools, and before after they came for the holidays. So there's a great program that you continue to do every year. Fortunately, this year we have to change a lot of things about our operation, of course, because of the COVID. But you still continue as possible, and this kind of program is very, very good. That I said that you join with our transit engineer company about the program of fiscalization and education too. There is an example that you use. Do you remember about the picture that the officers stop all the motorcycles to go to the roadside? So there's another program. You stop the motorcycle and put it in one patio that the motors can stop there, and you make some kind of rotation of the class for all the motorcycles and the riders who stay there. First, you go to the one class and look at the one agent of our engineer company, talk and speak about how important to use helmet, how important to pay attention during the rain, the velocity, and the other things that you use, and to show for the riders understand if your tire is in good condition or not. That's for example that you have in the photo in the middle. And on the right below, we have the one officer to show all the problems that maybe this motorcycle has for his owner, and to try to understand the maintenance and to keep the attention of all the maintenance, diary maintenance and the week maintenance, and the monthly maintenance, to conduct his motorcycle as well. Okay, we have just for show the numbers of our state. São Paulo state have 44 million people. In São Paulo state, you have around 9 million people. We have almost 8 million cars in São Paulo city. In São Paulo state, you have almost 30 million cars around the state. So we have a lot of work to do, a lot of tasks to do, and a lot of problems too. Okay, thank you so much.
Well, thank you very much, Colonel. Appreciate your insights into this global health crisis. You know, the traffic deaths and injuries are incredible when you look at the numbers, and most of those are all preventable. So thank you for that. Our next speaker is John Morrissey. He started his policing career in 1983. Throughout his career in the city of Kenosha Police Department, John worked his way up from detective, sergeant, lieutenant, captain, and eventually chief of police in January 1 of 2008. John retired from the police department in 2016 after 33 years of law enforcement experience. And then in January of 2020, John returned to the city of Kenosha and currently serves as a city administrator. He's been actively involved in suicide prevention since 2010, including leading the National Action Alliance for Suicide Prevention and Public Safety Task Force, being part of the Workplace Suicide Prevention and Post-Prevention Committees, and was selected to serve on the IACP's National Consortium on Preventing Law Enforcement Suicide. I'll turn it over to you, John.
Thank you, Vince. I appreciate that, and good morning to everyone. Just briefly, how I've got involved in this is in 2010, I had an officer on duty take his life, and it was the first suicide. And then 5 months later, we had another one. And in my researching of resources to assist me as a chief, there were few and far between, but working with the IACP, we've came a long ways. Next slide, please. So throughout this, the IACP for the last several years was on a campaign of awareness for that suicide of law enforcement officers was a problem. In fact, we were having more officers in the United States die by suicide than we did from line of duty deaths. And awareness and making sure chiefs were aware of it was a priority. In October of 2018, the IACP created a national consortium on preventing law enforcement suicide. And that was through the assistance of the U.S. Department of Justice, Bureau of Justice Assistance, the International Chiefs, the Education Development Center, and the National Action Alliance for Suicide Prevention. This consortium is a very wide-ranging and diverse group of individuals, from police chiefs to police unions, to dispatchers, to doctors, to therapists, to EAPs. It is a diverse group that has worked together here. I couldn't be more proud. This national consortium had 5 task force: the messaging task force, data and research, organization and system change or culture change, peer support, and family support. Next slide, please. So this slide here will just basically say the framework for that has been done. You can see around the wheel, there's 11 different topics that are there. Today, though, I'm going to try and talk about creating that culture that supports mental health, disseminating a safe and positive message, normalizing and increasing the help-seeking behavior, and identifying those people that are appropriate for peer support. We'll get into those of why I think they're so important. Next slide, please. So we're going to create this today, hopefully this framework, so you understand how important the culture is, the the safe and positive messaging, I'm hoping today everyone will realize that we've probably been doing it incorrectly for quite a while. And then again, in the peer support. Next slide. So I always like to start off any presentation I do that this should be the goal of every law enforcement officer or every agency, no matter public safety related, and quite frankly, it doesn't even have to be related to public safety. Our goal should be to let's stop officers from ever getting to the point that they consider suicide as an option. If we start with that as our goal, we can get there. I truly believe that, but that has to be our priority, that suicide is never even an option for these officers to consider. Next slide. So creating a culture that supports the mental health, and this is a very tough task for a lot of departments. And how we get there is it has to start at the chief, the commissioner level. They have to be the driving force to say that the culture in this department has to change, that it's okay for officers to come forward and say that I'm struggling, that I need help. And that becomes a normal conversation, not a there's penalties or you can't have your job if you come there. I have several officers that work in the Kenosha Police Department that have attempted suicide and are currently back and very productive members of the police department. I would say are probably in a much better place now going through this, and it is tough. But again, if the chief can create that, and as we create that culture, we have to make sure that everybody's included. So if you have a unionized department, that the union's involved. I believe that the most important people here are the chief creating that culture, but then the sergeants or the training officers, that line between administration and the patrol officers, that is where the most important part is in creating that culture for ingraining it into the officers that it is okay to come forward. Next slide, please. In creating that culture, you'll see on the picture there, ask for help. That's what we have to do. We have to get this culture that your agency is doing that and saying it's okay, come forward. Mental health check-ins has been a recent topic, and a lot of departments are doing that. And it's just simply a check-in. Again, they can be anything from formal to, you have one every year that goes along with your annual physical, if you have those. Or it can be as simple as individuals. Again, I would rely on your mid-level supervisors to do this, to just check in with the officers. I've learned through the years the things that may not concern me, such as traffic fatalities, as the colonel had just talked about. There's so many, but there could be other reasons. And a version of that is we had a officer work and his parents were killed by a train accident. Unfortunately, we have several trains that go through the city here, and he got sent to a car train accident, and it brought back all of the things. But what we as leaders don't see, and certainly as the chief, I'm not necessarily aware of where every officer is going, but the sergeants are. So again, the mental health check-ins can be formal, they can be informal, they can simply be in roll calls of asking, how's everybody doing today? The other thing is we have to make it easy to help them get help, whether it's during work time. Stigma is still a major, major problem. So decreasing any barriers that are up there. And the best way to do that is through communication with the officers. What do they see the barrier? And I will tell you that the majority of times it's the stigma, and if I come forward, I'm going to lose my job. And if you change that culture, that's not going to happen. You have to look at how do you become aware of the mental wellness needs, and are they truly available? And there are therapists and EAPs out there. We've gone to providing more free EAP visits to all the employees here in the city. But we've also gone to occupational specific therapists, and that has worked out well. So we look for those that understand public safety, police, fire. Something we forget, I think, when we create the culture is the civilian employees. So I had a mid-sized department, 218 sworn, but I had 58 civilians, and then another side entity of 77 that did the dispatch and those kind of things. We need to make sure we can include all of them in our culture, and there's a difference of who those individuals need to be that are supporting their mental health. Next slide. So I think we have to focus on the facts. And I know this sounds simpler than it is, but if we treat somebody with cancer, you can reach out to them and most people will talk to them and ask how they're doing. But if somebody goes out on a mental health diagnosis, it's much tougher. And I understand it's tougher all the way around to say that an individual is suffering from mental health, but we have to treat them as the same. So if I break my leg, I can come back to work eventually. If I tell you I'm suffering with a mental health issue, whether it simply be stress or depression, that I can come back. This is the culture that we have to have. You know, it's the real world equation, as it says there, to the physical ailment. You can recover from this. And as I stated in Kenosha, we have officers all the way that have come forward to those that have physically attempted suicide, and they're back, they're productive. It takes a lot of work, but it is a culture that we need to do and need to change. We have to focus on those positive qualities, you know, the connectedness. Where law enforcement is always talking about camaraderie and problem solving, and we're the first ones. We don't run away from the problems. We run towards them, unless it's mental health. It seems that sometimes we turn and we look the other way because it's that stigma. But again, the culture change has to start with administration. And I just want to make sure we don't leave out the chiefs. That's always been a concern of mine, is that sometimes we leave out the chiefs, and you know, the chiefs suffer as well, and it's very tough for a chief to come forward. We have a chief in a village right next to the city here who lost a couple of good friends, and he came forward and he now speaks to law enforcement here in Wisconsin, and it makes a world of difference. But one of the things you got to do is build these into your policies and procedures. One of the biggest things that officers have an issue with is there is no policy, so the standards aren't the same. I'm not going to tell you what those standards need to be, but I will tell you that they need to be there, so everybody going into it understands exactly what the how to understand they're going to do. So if an officer dies by suicide, do they get the same type of funeral that an officer killed in the line of duty does? I'm not going to say which is right or wrong. Certainly most are leaning towards they do, because while it might not be, you know, somebody who was shot on duty and killed, they may have died due to the stress and the job itself. So I think we just need to remember that, build it into those. Mental health, integrating it into your culture. It's tough for smaller departments to have a full staff member, but as I mentioned earlier, if you have EAPs and you work with those EAPs and those therapists, and you make sure that they understand the occupation, you'll find that that's really integrating the mental health into it. Next slide, please. So this is one of my most things where I think we fail, is how we do the messaging. Some people have said, what is messaging? I believe messaging is anything that you do, whether it's me today, I'm presenting a message, whether it's newsletters, posters, speaking to families, officers, roll call in front of your officers, that's a message. Anytime you address somebody, written or verbal, that is a message. And sometimes we get lost in that. Press releases, media interviews, social media is certainly a major theme for departments now. But I think sometimes we forget that is messaging, and the words we use truly do matter. Next slide, please. So why is messaging important? It can promote those positive behaviors, it supports prevention goals, and it decreases barriers to help seeking. Or it can contribute to increased risk. It can undermine any of your prevention programs, and it can increase barriers to those seeking help. Next slide. So these pictures are what we would have typically used for suicide prevention, to say with numbers, sending the message that this is what we all believe the typical poster of an individual for suicide is. These have been used for years. We still see in the national media stories, and they'll run pictures similar to these. All of these are very negative feeling pictures. They send the message of hopelessness. We need to change that. Next slide, please. So these are more of the kind of pictures or posters that you should have. The top one, the hands, everybody's working together. We're part of a team. The Suicide Prevention Lifeline. If you need to talk, I'm here to listen. Don't forget to take care of yourself. These kind of things are what's extremely important into making sure that we are sending a very positive message in the, we're just going to make sure it's a positive message in these posters. Next slide, please. So when you're considering your messaging considerations, remember, don't discuss the details of the death or the means used. Avoid describing death by suicide as an epidemic or crisis. While it might be an epidemic or crisis, we understand that, but using dramatic terms like skyrocketing or trending, be aware, learn the warning signs, get involved, become available, show interest and support, ask if they're thinking about suicide, be direct. Talk openly and freely about suicide. You have to be willing to listen, non-judgmental. The next one's extremely important. You have to offer empathy, not sympathy. People will go to funerals, whether they're suicide or whatever, and they'll make statements like, he or she's in a better place, or they're no longer suffering. That's the last thing that people want to hear. The simplest and best thing you can say is, I'm sorry for your loss. Next slide, please. So one of the ways to really help, and we've done it here, is peer support. Next slide. So we developed a peer support team after the 2 officers in my department took their life within 5 months. It was a work in progress for 2.5 years. The biggest issues you're going to have initially are trust and confidentiality. And I would say 2.5 to 3 years before that program was up and running. And I will tell you now that 99% of the officers used the peer support team. The bigger you are, it's easier to have an internal peer support, but don't be afraid to use regional peer support teams. Don't be afraid, even internally, if you have one, if the officer doesn't feel comfortable talking to their coworkers, that they can go to a other peer support. And again, this is back to the culture and the chiefs having that. When you set up a peer support team, you really need to make sure that the scope is defined. You need to make sure that the correct officers are in there. There's officers that want to be part of peer support for the wrong reasons. The screening is extremely important. They have to remember that they are not therapists. They are there, but statistics and studies have showed more people will reach out to peers than they will to actual other individuals as therapists. Family is the number one. However, if the family is what is causing some of the stress, they're less likely to do that. Next slide, please. When you develop these, again, you got to ensure that the adequate resources are there. And through the whole themes this morning, you've heard the leadership. That leadership support is there. These are very tough to understand that if somebody has a mental health issue, I think there's that stigma still at the chief level that I'm just not sure, and how will they integrate back into the department? I assure you from personal support that if the individual seeks the help, they can come back and be an extremely productive individual. Again, individuals that want to be in the peer support, make sure you screen them, because if they're in there because they're the agency gossiper, that's the last person you want in there. And then you have to provide the support for the supporters. And that's extremely important to understand that peer support team members need to do it. Next slide. We're back to the framework. Next slide. And then there's the suicide resources. So we've got best practices, the IACP. This consortium has done a great job of providing resources for law enforcement that want it. Next slide. Here's some more additional resources, preventing law enforcement suicide, focusing on officer wellness, key strategies. Next slide. Some more resources. There's always the suicide prevention line and the lots of law enforcement lines out there. Next slide. I just want to thank everybody for listening today. I know it was a longer presentation, but getting the culture, the messaging and stuff is so important. Thank you.
Well, thanks a lot, John. Appreciate that. It's not an easy topic, and it's difficult to crack any kind of culture within any police department. So thank you for your insight. Our final presenter is Don Hedrick. Don serves as the chief of Rapid City Police Department and has managed the police department agencies, their wellness and officer resilience programs as well. And that forms the bedrock of its trauma-informed policing strategy, as well as their peer support and crisis intervention teams. Rapid City Police Department engages with the Native American community through their collective healing initiative in an effort to reduce high rates of violence, victimization, and incarceration among Native American in Rapid City. The department's policing strategy is focused on equipping those officers with the correct tools to assess and triage trauma and violence on the streets, in order to coordinate with higher levels of care and service to intervene and to end the cycles of victimization and crisis and violence. Chief, I turn it over to you.
Thank you. And good morning to everybody. And thank you for the opportunity for me to just talk a little bit about what we have going on here in Rapid City. Do I have about 5-10 minutes or so? Is that kind of where we're at? I want to leave some time for questions. Is that?
Yeah, 10 minutes is great. Thanks.
Okay, you bet. So here in Rapid City, we serve a pretty diverse population, but the primary community that we serve would be, not just the folks in our community, but we also have a very strong Native American population. And the census says that we have about 11% of Native Americans here in Rapid City, but folks that live here, we can tell you it's probably more like 20%, because we have several very large reservations in our community, and there's a lot of back and forth travel. For us, we have something that we've dealt with for many, many years, and it's very real, the historical trauma that exists here locally. We had some pretty terrible things happen here not so long ago, to include the Wounded Knee Massacre, and we have people still living today that lived through boarding schools. And when I moved to Rapid City, I hadn't had a lot of experience with Native American people. I just it was I grew up in a location that there weren't very many Native American people present. So I can clearly remember being a brand new officer and showing up on a call for service. And it was somebody that had called and asked us for help, like they were calling us. And I showed up and I remember working through all these layers of distrust just to be able to provide help. And I remember thinking back then, wouldn't it be nice if I could just skip right to the helping and break through that barrier of distrust sooner? And I think because of some of the initiatives that we have in place, because of the help of the IACP, because of our collective healing initiative, we're just in such a better spot now than what we were 20 years ago. Next slide, please. So really our collective healing initiative began in 2018, and we really were able to take our programming to the next level by taking a deep dive into wellness, resiliency, and understanding of trauma in our community. And that's helped us improve public safety. You know, we've had a lot of outcomes that have come out of our collective healing initiative. I just want to touch on a couple here on this slide. One of which would be our quality of life unit. And what that unit does is they're making contact with members of Rapid City's vulnerable homeless population. And they help to identify what social services would benefit them most in breaking the cycle of homelessness. Through casework partnership and local service providers, we're able to ensure members of our community are getting direct and tailored access to programs that will improve their quality of life. And additionally, I just also wanted to touch on, we talked a little bit about, Mr. Morrissey talked quite a bit about wellness, and it's a very much a staple in our program as well. But also, we've had, through our collective healing initiative, we've had work group sessions, listening sessions with our community, and we're going on 2 years now of these collaborative listening sessions with members of the community, focusing on reform and what's important to the community and the Native American folks that we serve. Next slide. So we've really focused on historical trauma and the training that we can bring to our officers. We brought in Native American experts, elders in our community that could help provide the expertise that we needed to bring understanding as to how and why historical trauma exists. Our quality of life unit was actually tasked with working with members of our community with a focus on a greater understanding of the historical trauma and the events that led to the promoted distrust of the government. And it's been an amazing experience. Yep, you can, next slide, that's fine, thank you. So a couple of the partners and programs that have been engaged in our cultural awareness program here. As you can see, we've been on this path towards historical trauma training and progressive programs and events for quite a while now. It's leading us to the evolution of a co-responder model. I'll touch on that just very briefly, but that's in the works. And additionally, our Handle with Care program, I'll touch on that just a little bit here in a minute. Next slide, please. Additionally, the community-based crime reduction grant was a continuation of our collective healing work and a way to allocate resources to sustain and enhance what we had accomplished in the previous 3 years. Plus, as a side bonus, we got to utilize the IACP as our technical training assistant for 4 more years. So that was good. Next slide. The CBCR grant is really meant to carry on our collective public safety approach with the community by focusing on trauma-informed work and community collaboration. Essentially, we have people in our building that are responsible for trust building and partnerships in our community, at the same time working to reduce crime and victimization. Just a side note, our outreach specialist involved in this program is hosting a Easter egg hunt here on Saturday. So if you're in Rapid City, please let me know and invite you to stop by. Next slide. So I just briefly mentioned we're in the process of building a pilot program for our crisis intervention training based response and pulling in experts from the field to help us at the intervention point. So we're working with fire, EMS, police, the sheriff's office, behavior management systems, Native American service providers. And currently we have about 58% of our officers that are CIT trained. And obviously we have the goal of hitting 100% there. But really what we're trying to do is put more resources at the intervention point, bringing more folks besides police officers to the point of crisis, issues with mental health, substance use, etc. Just kind of a sneak peek into the future, we're also going to be looking at, looking at applying for the IACP law enforcement training and collaborative crisis response here in April. Really think that'll lay the framework for success. So if there's anyone out there on that program, I want to talk to you. That's a joke, but not really. So next slide, please. You know, our collective healing initiative just really, as I had mentioned, had a focus on officer wellness and peer support. And, you know, as stated, I'd like to just echo, you know, healthy officers are happy officers. And, you know, we kind of have a mantra around here that we encourage people to take care of themselves so they can take care of others. And we just really need to make sure that that is a focus for us. And I think we've already highlighted why that's so important. Additionally, we've put together a full-time wellness coordinator position through a COPS grant, which really has increased our effectiveness as a peer support team, really allowed us to take all of our wellness programs and coordinate them with the goal of more effective services to our department. Next slide. So all of our programming that we're putting together has a focus on preventing trauma to our youth. And we've used data from the Collective Healing Initiative to identify trauma and victimization in our community. And we've created a concerted prevention and intervention strategy. Next slide. So just a couple examples of youth outreach here. We've partnered with Native American service providers to respond to youth in crisis, where our officer and a youth navigator show up to every Native youth mental health crisis call. And this has been met with a 98% referral for youth and family. Additionally, we've used the framework to apply for a COPS grant to bring on 3 police officers and a youth navigator to make responses to youth in crisis, bringing resources here again to the point of intervention and conducting coordinated follow-up and case management. Additionally, we've been working with the school system on a Handle with Care initiative, partnering with school and school resources and school counselors to address trauma with kiddos that might have encountered that the night before. Essentially, it's law enforcement letting the school know that, hey, a traumatic event happened here with this kiddo, might be good to keep an eye on them. And, you know, might be an explanation as to why they would be acting up and such. Next slide. So our police athletic league, this is something that has been very positive for our community. And the history of this was several years ago, we have a kind of a street dance where they block off a road and have a band and people come together. And we had some kids on the outskirts of this event causing mischief and doing, you know, things that juveniles do, getting into scuffles and whatnot. And it was really becoming kind of a distraction for this event. And a couple of our officers had an idea like, hey, let's bring a basketball down there and a hoop and let's try and engage them. And we said, yeah, go for it. Let's try it. What do we have to lose? So it really expanded. It became a program that, you know, not only did we have now kids playing basketball with cops, it became this positive engagement where many of these kids did not have positive experience with the police officers prior. So for us, it's went really well. Since then, it has turned into its own self-sustaining 501c3. We have a place at the table, but really the community has taken this program over and made it successful.
Well, thanks a lot for that, Chief. I know we're pushed for
Yep.
time here, and
Oh, that's good. We can wrap her up, but thank you. I appreciate it.
I just want to thank everybody from the Law Enforcement and Public Health Conference and the ability for us to come on and present with IACP and some great examples from our panelists. And I wish we had more time. We could go on for a long period of time here, and plus we have many more examples, but I hope we touched on some of that connection between law enforcement and public health and meet the audience needs. So I want to thank all our panelists today for their participation, and appreciate your effort, and good luck with the rest of the day. So thank you all.